Good afternoon, everyone. Today, we're going to discuss the potential risks and considerations for taking modafinil, a popular wakefulness-promoting medication, in patients with some specific diseases like hypertension or liver disease. This is a very important topic as we want to ensure the safe and effective use of this drug. Next, we will discuss the potential risks and interactions when taking modafinil alongside other supplements or medications. And finally, we'll be discussing how to boost the positive effects of modafinil by stacking it with other supplements or nootropics. Before we dive deeper into this topic, don't forget to subscribe to our channel for more research results related to productivity, health, and well-being. Now, let's begin. So, let's start with hypertension. The research highlights a few key risks and considerations. Firstly, modafinil can increase blood pressure, which may exacerbate existing hypertension or make it more challenging to control. This risk is not isolated to one source, but is emphasized across multiple studies and reports. In clinical trials, a small percentage of patients taking modafinil experienced clinically significant elevations in diastolic blood pressure. Additionally, the use of modafinil may require careful monitoring in patients with severe or uncontrolled hypertension. In some cases, modafinil treatment even led to the initiation or adjustment of antihypertensive medications to manage blood pressure levels. This underscores the importance of consulting with a healthcare provider and closely monitoring blood pressure when considering modafinil for individuals with hypertension. Now, it's important to note that while these risks are important to consider, modafinil did not significantly elevate mean blood pressure compared to placebo in most studies. However, the potential to worsen hypertension or necessitate medication adjustments is a serious consideration, especially for those with pre-existing cardiovascular concerns. Next, let's turn our attention to liver function. According to multiple sources, modafinil is listed as having a disease interaction with liver disease. This means that caution is necessary when prescribing modafinil to patients with hepatic impairment. Modafinil is primarily metabolized in the liver, and liver disease can significantly impact this process. In clinical trials, modafinil was associated with a low rate of serum aminotransferase elevations, which are markers of liver injury. While there have been no reports of clinically apparent liver injury due to modafinil, it's important to recognize that rare cases of severe hypersensitivity reactions, such as Stevens-Johnson syndrome, have been linked to the drug, and these can potentially affect the liver. Additionally, it's important to consider the impact of impaired drug metabolism and clearance in individuals with liver disease. The reduced function of the liver may lead to increased exposure to modafinil and a subsequent heightened risk of adverse effects. As a result, dose adjustments may be required for patients with hepatic impairment to mitigate these risks effectively. Now, let's discuss mental health. According to multiple sources, including case reports and literature reviews, modafinil may worsen or exacerbate symptoms of psychiatric conditions. This is particularly relevant for conditions such as anxiety, mania, and psychosis. The sources highlight that caution is warranted when prescribing modafinil to patients with these disorders. For instance, one case report describes a patient who developed persistent psychosis after a modafinil overdose. The authors of this report note that modafinil's effects on neurotransmitters like dopamine and norepinephrine may contribute to neurochemical and behavioral changes. Additionally, an article discusses how modafinil abuse led to a worsening of psychotic symptoms in a patient, even while they were taking antipsychotic medication. Furthermore, the Wikipedia article on modafinil mentions that psychiatric symptoms like psychosis, mania, hallucinations, and even suicidal ideation can occur with a modafinil overdose. Importantly, these effects may persist even after discontinuing the drug. As a result, close monitoring is strongly recommended when using modafinil in patients with pre-existing psychiatric disorders. Next, let's discuss the potential impact on seizure disorders. According to drugs.com, modafinil is listed under the disease interactions section as having an interaction with seizure disorders. This suggests that modafinil could potentially worsen or increase the risk of seizures in patients with epilepsy or other seizure disorders. However, it's important to consider the nuances provided by other sources. For instance, a study by Baranjit found that while low doses of modafinil had an anticonvulsant effect, higher doses exhibited a proconvulsant effect, increasing seizure susceptibility in an animal model. On the other hand, a retrospective study by Artsy found no clear exacerbation of seizures in epilepsy patients taking modafinil over 10 years, though a few individuals discontinued due to seizure concerns. Additionally, Lushki reported that modafinil and its metabolites enhanced the anticonvulsant effects of some anti-epileptic drugs in animal models at typical clinical doses. So, while drugs.com flags a potential interaction, the overall evidence suggests that modafinil likely does not significantly increase seizure risk at typical therapeutic doses, especially when combined with anti-epileptic medications. However, it's important to note that higher doses of modafinil may lower the seizure threshold. Therefore, close monitoring is still advisable, particularly when initiating modafinil in patients with seizure disorders. Now, let's gain some understanding of the potential risks and interactions when taking modafinil alongside other supplements or medications. You must keep in mind that modafinil has at least 486 interactions with other medications, and we are mentioning here just a few. For more detailed information on the topic, you can study links in the description and consult a specialist. Firstly, we have caffeine. And it's important to note that both caffeine and modafinil can increase blood pressure and heart rate. Combining these two stimulants may enhance these effects, leading to increased cardiovascular strain. If you're a coffee enthusiast, be mindful of your caffeine intake while taking modafinil to avoid any unnecessary strain on your heart. Next, while specific interactions with herbal supplements are not detailed, the search results emphasize caution when taking over-the-counter supplements or medications alongside modafinil. Always consult your healthcare provider before introducing any new supplements to your regimen to ensure they won't interact negatively with your modafinil prescription. Additionally, it's crucial to avoid combining modafinil with other stimulant medications, such as amphetamines or dextroamphetamine. This could lead to overstimulation and exacerbate unwanted side effects. If you're already taking stimulant medication, do not add modafinil to the mix without seeking medical advice first. For those taking antidepressants or psychiatric medications, including drugs for anxiety and psychotic disorders, be aware that modafinil can interact with these medications. It may alter their effects or increase certain side effects. Again, consulting your healthcare provider is essential to ensure a safe combination. Lastly, an important consideration for women. Modafinil may reduce the effectiveness of hormonal birth control methods, including pills, patches, rings, and implants. This could increase the risk of unintended pregnancy, so alternative contraceptive methods or additional protection may be necessary. Now, something more optimistic. We'll be discussing how to boost the positive effects of modafinil by stacking it with other supplements or nootropics. Let's start with L-theanine, a compound found naturally in tea. A daily dose of 200 to 400 mg can help reduce anxiety and improve focus without causing drowsiness. L-theanine promotes relaxation without sedation, making it perfect for those who need to stay calm and focused. And it can be taken with modafinil in the morning, or split into 2 doses, one in the morning and another early afternoon, so you can maintain a calm focus throughout the day. What's really interesting is how these two work together. Research shows that L-theanine can help smooth out the stimulating effects of modafinil, providing a calm, focused energy that's both effective and sustainable. Studies, like the one published on the National Center for Biotechnology Information, have highlighted this synergy. Participants who took both modafinil and L-theanine reported enhanced cognitive performance with fewer side effects compared to taking modafinil alone. Now, let's talk about Bacopa monnieri. This herbal supplement has been used for centuries in traditional medicine for its memory-enhancing properties. With a daily dose of 300 to 450 mg for standardized to 55% bacosides, Bacopa monnieri supports cognitive function and may even help reduce anxiety, providing a calming effect that complements modafinil's focus-enhancing benefits. It's recommended to take Bacopa monnieri with breakfast, as it's best absorbed with a meal containing some fat. Alternatively, it can be taken in the evening, as it doesn't have stimulating effects, allowing you to unwind and support your cognitive health throughout the day. Research, such as the study published on the National Center for Biotechnology Information, sheds light on the potential synergy between modafinil and Bacopa monnieri. Participants who combined these two supplements reported improvements in memory, focus, and overall cognitive performance. Now let's talk about rhodiola rosa. This adaptogenic herb has a long history of use in traditional medicine for its ability to combat fatigue, reduce stress, and improve mood. With a daily dose of 200 to 600 mg of standardized to 3% rosavins and 1% salidroside, rhodiola rosa complements the cognitive benefits of modafinil by reducing fatigue and promoting a positive mood. It's important to note the dosage instructions for rhodiola rosa. It's best taken in the morning or early afternoon to avoid any potential interference with sleep. Due to its stimulating effects, it's advisable to avoid taking rhodiola rosa late in the day. Research, such as the study published on the National Center for Biotechnology Information, supports the use of rhodiola rosa in combination with modafinil. Participants who took both supplements reported improvements in cognitive function, mood, and overall well-being. All right. Next, we have alpha-GPC. This compound serves as a choline source, crucial for acetylcholine production, which plays a vital role in memory and learning. With a daily dose of 300 to 600 mg, alpha-GPC complements the cognitive benefits of modafinil by supporting neurotransmitter function and enhancing cognitive processes. Alpha-GPC can be taken with modafinil in the morning to kickstart your day. For sustained cognitive benefits throughout the day, consider splitting the alpha-GPC dose between the morning and early afternoon. Research, such as the study published on the National Center for Biotechnology Information, highlights the potential synergy between modafinil and alpha-GPC. Participants who combined these supplements reported improvements in memory, focus, and overall cognitive performance. Sounds interesting. Now, let's talk about N-acetyl L-tyrosine, or NALT for short. This compound supports the production of dopamine and norepinephrine, neurotransmitters crucial for mood regulation and focus. With a daily dose of 300 to 500 mg, NALT complements the cognitive benefits of modafinil by enhancing mood and providing an additional boost in focus and energy. When it comes to dosage instructions, NALT should be taken with modafinil in the morning to kickstart your day. Additionally, NALT can be taken before cognitive tasks or physical exercise for an extra boost in focus and energy, making it a versatile supplement for enhancing performance. Research, such as the study published on the National Center for Biotechnology Information, highlights the potential synergy between modafinil and NALT. Participants who combined these supplements reported improvements in mood, focus, and overall cognitive performance. However, while the search results don't provide extensive clinical data, the general consensus seems to be that supplementation with NALT or L-tyrosine, especially at higher doses, has the potential to elevate blood pressure levels in some individuals. This risk may be higher in those already suffering from hypertension. Now, let's talk about phenylpiracetam. This compound is known for its cognitive enhancing properties particularly in improving memory and focus. With a daily dose of 100 to 200 mg, phenylpiracetam complements the effects of modafinil by further enhancing mental performance. When it comes to dosage instructions, phenylpiracetam should be taken with modafinil in the morning to kickstart your day. However, due to its stimulating effects, it's best to avoid taking phenylpiracetam late in the day to prevent sleep disruption. Research, such as the study published on the National Center for Biotechnology Information, highlights the potential synergy between modafinil and phenylpiracetam. Participants who combined these supplements reported improvements in memory, focus, and overall cognitive performance. Remember, if you're considering adding any of these combinations to your regimen, start with lower doses and monitor your body's response. As always, consult with a healthcare professional before introducing any new supplement into your routine. And that's all for today's video. As always, links to research papers are in the description below. Watch another interesting video we have prepared for you. The link should be visible on the screen. And for more healthy insights like this one, subscribe to our channel. Stay tuned, stay healthy.